We're thrilled to have in studio with us today Dr. Jake Smith. We're here to talk about all things glaucoma, from early diagnosis to the advanced stages of the disease. Now, Jake, welcome to the program. Good to have you back.
Thank you very much.
Or should I call you Dr. Smith? Or
Jake's good.
Jake's good. Okay. So just letting folks know that, Jake was practicing previously on the island. He was away for a bit. Now he's back. He is a general ophthalmologist who has worked in Bermuda since 2018. He completed his training in London at Moorfields Eye Hospital and undertook subspecialist fellowship surgical experience in glaucoma surgery. And we're going to expand on that. Jake has worked as part of a small team to provide comprehensive ophthalmic care since he completed his training. Extensive surgical experience, so he's going to tell us a little bit about that, as well as with glaucoma and cataract procedures and various other traumas and emergency surgeries in eye care. He's passionate about providing high-end eye care to island communities. So having recently opened his own practice, we'd like to welcome Dr. Smith of Eye Health Clinic, which is located at 14 Dundonald Street West, next to Smile Dental, opposite Masters. You can't miss it. Welcome, Dr. Jake Smith, to the program. Good to have you here.
Great to be here. Yeah.
Good to have you back. We've been having just a quick little chat about sort of all things glaucoma and the advances in the care for it and all. But I suppose we should start with an overview, if you don't mind, Jake, of what is glaucoma and sort of how do people end up with it?
So glaucoma is the commonest preventable cause of blindness, of vision loss. Mm-hmm. It's a disease of the optic nerve, so the nerve that carries the information from the eye to the brain. Mm-hmm. Yeah. And it's a gradual loss of that nerve's ability to carry that information. And that first is noticed by loss of the peripheral vision.
Gotcha.
Particularly if it's just in one eye and the other eye covers the gap that one's missing. It's often not noticed until it's quite advanced. So it's sometimes called the silent thief of vision.
There you go. And the brain is so clever at figuring out how to compensate for things. Having some side issues myself, I know how that works a little bit. Yeah. But I think the thing we want to emphasize here is that if one is not aware, then the slippery slope of sight loss is a little harder to stop with glaucoma. So is it hereditary? Is there any hereditary component, sir?
There is a hereditary component to glaucoma in the same way as, say, for example, heart disease is hereditary. Mm-hmm. It's not a single gene. It's clearly a combination of factors.
Gotcha.
But there are some families in which it runs very strongly.
Oh, wow.
So there are certainly families I've seen where every member of the family has it.
Wow, every member. How about that? So someone, again, this is again about finding out sooner rather than later if that is an issue. Know your family history, I guess, is a good takeaway from that particular statement. But how to avoid it then if there is that component going on?
Because it's the silent thief of vision, it's often not noticed in its early stages. The patients really haven't noticed that the peripheral vision in one eye has gone, and that's a big part of the job that optometrists and that I do, particularly these visual field tests. So testing the peripheral vision, and then we look at everyone's optic nerve that we see, and you can usually see glaucoma in the way the optic nerve looks, in the appearance of the optic nerve. Okay. Early on in this disease, before it's really caused extensive loss of vision. So
again, we're emphasizing that if one has an annual checkup, their GP would want to say, get an eye test, see your optometrist or your ophthalmologist. Either.
And it's at those regular annual eye tests that both optometrists and, of course, ophthalmologists do that it's usually picked up. If it's not picked up there, it's usually gotten to a pretty advanced stage already. Gotcha,
yeah. And we've mentioned many times how there are many sort of early signs of many diseases, metabolic diseases, things like glaucoma, and others that are detectable through having your eyes examined. So again, we want to emphasize, make sure that you have an eye test. In children, is it common, or is it mostly in older folks? Just as a FYI, I'm sort of asking that.
It's a disease that gets commoner as we get older.
Gotcha.
There is a very unusual version of glaucoma that happens in babies, actually, in young children. And that's often picked up in the first few days to weeks after birth. That is unusual.
Gotcha.
And you would know about that pretty early on.
Gotcha.
The nice thing about the infantile glaucoma is that it's treatable.
Totally treatable
totally
if he's
treatable.
picked up, yeah.
Exactly.
And again, that would come from looking at those babies' eyes and looking at the optic nerve, or there are things that manifest themselves?
There are things in children that are a little bit different. So
Gotcha.
because the pressure's high in children, the eye gets bigger.
Wow.
And you can actually see that.
So it's noticeable in
noticeable
the face,
in infants, in babies, yeah.
For sure. So as far as, we're emphasizing, get your checkups, folks. Make sure getting an eye exam is part of that annual thing. And if there is a history of it, should it be more often than that, Dr. Smith, do you think?
I think annual is
Annual's good
adequate.
enough? Adequate, yeah.
And if there's any suspicion that there might be glaucoma, and there are a number of people who, for example, have high pressures but normal optic nerves,
Gotcha.
or who have optic nerves that are looking suspicious but normal pressures. There is a group of people in whom we're suspicious of glaucoma, but we don't know they've got the disease. Then we might arrange just regular follow-up without any specific treatment.
Gotcha, just to keep an eye on things.
Yep.
Yeah, and most of these things are not generally invasive. We don't want people out there freaking out about what they're going to have done to their eyes.
Right.
A general field of vision test and the puff tests that they do and things like that.
That's right.
Not scary at all. Go make friends. Have a chat, right?
Yeah.
So many of the technicians who are there's even, a lady who does it mobile around here now,
That's right.
so which is
Yeah.
wonderful. And then she can refer to a doctor like yourself if things are picked up on it. So we're just encouraging all our listeners right now. We are talking on Vision Talk today to Dr. Jake Smith, who has a new eye clinic, the Eye Health Clinic, located at 14 Dundonald Street West, next to Smile Dental, is joining us today for our chat of all things glaucoma. So let's say that diagnosis has come, and the inevitable question is, what next? Right?
Yeah.
How can I be cured, if so, or arrest it, or what is the general sort of course of things after one has the diagnosis?
So cure suggests a once and done treatment, which I'm afraid isn't
the case.
Isn't usually the case. There's three ways in which we treat glaucoma. There's laser, there's drops, and there's surgery.
Okay.
In the past, drops, because they're easy to use, has been the first line treatment. There was a very nice study done in 2019 that has really changed the way in which we treat glaucoma, and it compared drops to laser, and really showed that not only is laser at least as effective, if not in some ways perhaps more effective than drops, but also that it's cheaper.
Gotcha.
Which actually
when
matters.
we're talking about the economics of healthcare these days, right?
Yeah.
That always sounds good. But before we went on there, we talked a little bit about the technology for using laser treatment for glaucoma has been around for a good long while now, but there was just that either hesitance or not understanding, the costs over the long run or things like that, where it was inhibited it being done more.
I think because glaucoma tends to affect older people, and because it's a very slowly progressive disease,
Sure.
And there have been over the years a number of treatments that were thought to be revolutionary and haven't lived up to the promise
Gotcha.
that they had. I think when laser was new, which was more than 20 years ago now, must be 25 years ago at least, there was some skepticism to introduce
Its effectiveness, yeah.
And it's taken a long time for it to be more widely accepted, but I think it now really is widely accepted.
Because the larger studies have been done, like you mentioned, as well, and just not only on effectiveness, but costs as well. It takes a while to compile that much data and have that many people in a study to see what those costs are. So in your practice these days, drops versus laser versus surgery, can you sort of tell us sort of how that sort of balances out?
So I think I mean, I do a lot of both drops and laser, and,
Sure.
and increasingly more laser.
Mm-hmm.
Surgery, because it's much more invasive,
Sure.
is reserved for when drops and laser have failed.
Have not
And
been effective. Okay.
There is certainly, plenty of people in whom you've tried drops and laser, and they need surgery. And the key is not to delay too long with surgery. Vision that's lost through glaucoma is permanently lost and can never be returned. The best you can hope for with treatment is to preserve the vision you have.
Arrest the progression of the disease. Okay.
And that's why delay of surgery is a mistake.
Sure. And again, diagnoses is that much more important for where the disease has progressed to. And so again, we're emphasizing that folks need to think about that with their annual doctor's visits to make sure you get your eye exam. Now, with I've seen a little bit about, and we've had a few folks on the program to talk about how important it is for those on the eye drop regimen, because that proves effective for a lot of folks, and they're comfortable with it.
Yes.
And hopefully have enough insurance to cover costs and all of that. All those things said, this is not the type of thing where you can just say, "Oh, I've run out of my prescription. That's okay. It's Friday. I'll wait and get it Monday." It has to be this regular regimen of these eye drops. Yes.
And that's probably the reason why in the trials the laser turned out to be perhaps slightly superior to the drops.
Sure.
The suspicion is that if you actually take the drops every day, they're probably as good as laser.
Uh-huh.
The advantage of laser is it's a once and done treatment,
yeah. Mm-hmm.
and you don't need to remember every day to take your drops.
Gotcha. Can you explain a little bit about sort of what the medication of glaucoma drops are, and or what the laser actually does?
Yeah.
As far as we can understand, us lay folk.
So there's a little spongy material called the trabecular meshwork through which the fluid in the eye drains.
Okay.
And it drains through a filter, through a sponge. Mm-hmm. And over the years, one of the ways in which pressures in glaucoma can go up is that sponge gets clogged. Like a filter paper, it gets full of crud.
Yes, stuff in your eyes. Yes.
And the laser gives it a little tap, a little bash that resuspends all the stuff that's got caught in that filter. And second time round, a lot of it just goes straight through.
Got you. Okay.
And so it clears that
little mesh sponge thing we're talking about.
That filter paper.
Okay.
And allows it to filter more effectively.
So how do the drops then do what they do?
There's a number of different classes of drops.
Gotcha.
There are those which reduce the amount of fluid you produce that can lower the pressure.
I see.
And then there are those which can allow fluid to drain more easily.
Okay.
And they're a class of inflammatory medication. One of the interesting things we found many years ago is that patients with inflamed eyes actually have lower pressures.
Yeah.
And
okay.
the commonest class of medications to reduce pressures are actually an extract of the inflammatory prostaglandins, they're called, that are the aspect of that inflammation that lowers pressure.
So it's a little bit counterintuitive when we think of inflammation causing pressure. This is something that actually a part of it that helps to reduce it. So that's kind of cool to know that works a little bit backwards. It's like how our eyes see things upright and then our brain switches it, or vice versa. It's kind of it's that fascinating thing that goes on there. So what recent advances in glaucoma treatment? We talked about the laser being around for a while. Has there been any advances in the type of things that make up the laser or the surgical procedure?
Well, I think that the studies that show that the effectiveness of laser are relatively recent. I mean, that study was 2019, just before COVID,
okay,
and it's really only just come into widespread use. There are a number of new surgical techniques that are often done along with cataract surgery, called MIGS, microinvasive glaucoma surgeries, that have become more widespread. They're useful in the sort of patients that do well with drops and laser too,
Gotcha.
And they can just reduce the burden of drops particularly.
Gotcha, yeah.
Often done at the same time as cataract
Yeah, like you
surgery.
mentioned, cataracts, that's probably another big part of your practice here, and we have talked about the advances in taking care of cataracts. I know many folk that are so worried about anything to do with your eyes, and the fact that you're sometimes not under, or oftentimes not under, general anesthesia. You got to sort of be awake while you're poking around at your eye, but and it's necessary, I guess, in certain circumstances. But now having something that can be done in the same instance, then that's less, again, costs less scheduled OR time, less of everything and everybody's time. And so is this something that you see sort of the dual diagnosis thing going on sometimes?
In somebody who's got both cataract and glaucoma, there are some techniques one can use whilst doing cataract surgery that can reduce the pressure in the eye. And
the burden that their drops are.
And it's just one surgery which makes that worthwhile. We know that cataract surgery alone can reduce pressure, and actually usually the first thing I think of in somebody who has a bit of cataract, as almost everyone does when they get to a certain age, and glaucoma, is get the cataract done early.
Sure.
It helps reduce pressure in eyes.
Yeah, and that's going to slow the progression of glaucoma. It all sort of stands to reason right there. Now, we do know that certain metabolic diseases influence sight loss and the progression of things that cause sight loss. Does diet and exercise help?
There have been a number of studies on that. Now, we know that diabetes and glaucoma are associated, and we know that diabetes and exercise and diet are related.
Sure.
So anything that can reduce blood sugars and prevent diabetes or control diabetes if you already have it is going to be of benefit in glaucoma.
Gotcha.
And the same goes for blood pressure.
There, absolutely. Blood pressure as well. Yeah, if you're going to work on getting, if you have those issues, getting them under control can certainly reduce your chances of glaucoma starting at all, right? Or certainly help in it not advancing. I would assume.
Those usual things of exercise and keeping weight under control have a small but noticeable impact on glaucoma.
Sure. Good to know. Good to know. Folks, are you listening out there? I hope you are, because we're talking to Dr. Smith, who has his own eye practice now, the Eye Health Clinic at 14 Dundonald Street West, next to Smile Dental. And we're talking all things glaucoma right now. So diagnoses, do you find people's ability to wrap their brain around it sometimes a bit of a struggle? What is sort of how to deal with it? Do you recommend that they chat with our friends at Vision Talk about stuff, or that's a part and parcel stress, I would think?
Yeah, I mean, because it is the silent thief of vision, glaucoma, there are a number of people who have got to quite an advanced stage with glaucoma, before it gets found and treated. And because the vision that's lost through glaucoma isn't recoverable, there's a huge amount that Vision Bermuda can do with those who have already lost vision.
Yeah, so if someone knows that, or has someone that they know that has recently had the diagnosis, sort of best advice for I guess, family support. I guess the fear of sight loss can be huge, yeah? So we're talking general support, perhaps having a chat with a health counselor of sorts to really understand. Some folks are afraid to talk about anything medical, but this is the type of thing where I would think knowledge is power, and you would want to find out a lot if you can.
And you've been very good at saying there really is nothing to fear.
Sure.
The people shouldn't avoid getting their eyes checked for fear, because I don't think any of our treatments are particularly unpleasant.
Sure,
really. It's not. Even if you speak to people who have had cataract surgery, I think most of them are like, well, it's really not.
Yeah,
that
I had
big
no
a deal.
idea it would be like such a walk in the park type thing. And
Exactly.
you wear an eye patch or shades or anything for a day, and you might have some slight irritation. But yeah, we just want to encourage everyone listening out there right now to not put off if you have even the slightest idea of someone with sight issues, or you have some unexplained things going on with your eyes. You're not quite sure why they're very watery, or they're very dry, or they're very anything. This is something you want to ask for some input from a professional. So there are various things that go on with Teresa as the vision rehab therapist at Vision Bermuda. So again, I guess we're emphasizing that the support and the programs are there to help those who perhaps have lost sight due to glaucoma more than anything else.
I work, I hope, quite closely with Teresa, in certainly with those who have lost a significant amount of vision. She offers a fantastic service.
Absolutely, absolutely. So we want families again to recognize that there is support out there in the form of Vision Bermuda and the great staff that are there with Teresa as the therapist at the helm of it. So I think anything else we want to leave our listeners with today? We've covered quite a bit with that, and we want to let people know 14 Dundonald Street West, right? You can contact Dr. Jake Smith for an appointment at 543-1800. Is there anything online that you want to let our listeners know about?
We have a website.
Okay.
ihealthclinic.bm.
Okay.
It's a very nice website.
All right, so we want people to check that out. Now, we did have an article in our news just now about World Sight Day coming up. Do you have anything to say about that? We know that there's going to be a proclamation of World Sight Day. As a as a doctor in that medical profession, this is something that's great because it brings attention, I guess, to all of the things that go along with what you do.
I think that's the goal of World Sight Day. And I think the reason that glaucoma is such a relevant topic is that it's the silent thief of vision.
Again, we keep saying that, folks, because we want you to get the picture here before you can't see it, right?
Exactly.
Yeah.
Yeah.
So that's coming up, and there probably will be the story on our TV news tonight, too. That's coming up Thursday, the 12th of October. There will be a gathering at 12:30 p.m. on the steps of City Hall. And anyone's welcome to come and join our town crier as he mentions that. We also want to mention that Lindo's Warwick are very kindly hosting a tag day on Thursday the 12th of October in support of Vision Bermuda, and Lindo's Devonshire are offering a roundup day for them as well on that day. So thanks so much to Lindo's. They're a big part of us being able to get this program out to you. So just a reminder to all the listeners out there that we have moved the program up an hour. We're now at 5:15 p.m. every second Monday of the month. And here we are getting almost to the end of the year. So our next Vision Talk, which will be on Monday the 13th of November, choosing a gift for a person with vision impairment. And Teresa will be back in studio for us with that. So, Dr. Jake, we'll call you Dr. Jake now because I think that's kind of cool.
That's what most people call me.
Dr. Jake Smith has been talking all things glaucoma, but check out his website once again, which is, Dr. Jake?
www.ihealthclinic.bm.
iHealth Clinic.
All
okay,
one word.
folks, all one word, the iHealth Clinic. And 543-1800. It's really good to have you back, Dr. Jake. And, I dealing with thyroid eye disease. I just want to throw that out there. It's been something that, for the most part, you can just get the right glasses to sort out little muscle issues and stuff like that. But is that something that you're involved with as a surgeon here as well? So it's good to know to have these experts on the island and specialists on the island that can deal with things like that. It's been a pleasure having you here, and so good to have you come up again.
It's great to be back. It really is.
I'm sure there'll be another time when we'll discuss perhaps one of the other sight loss issues that you deal with on a regular basis. Again, look forward to that.
Maybe we can talk about thyroid eye disease.
Well, I'm sure that's a great thing to talk about. And there's so much, even in the treatment of it now that you see through the nightly and the different things they do about it now for the various effects that it has. But it's a bit of a rogue thing. From what I've come to understand, it doesn't always obey all the rules that they try to make about it. So that's depending on the individual. So that'll be something interesting to discuss, I'm sure. But we want to thank you for joining us today, Dr. Jake, and talking all things glaucoma. Once again, the iHealth Clinic, 14 Dundonald Street West. Of course, Vision Bermuda, Beacon House is almost open. And it will be. When Teresa gets back, we'll have lots to talk about for that, perhaps for the holiday season as well, and the great things that they do. But any last bit of advice you want to leave our listeners with, apart from, come see me, right?
I think that's the main topic is it's that particularly glaucoma is that silent thief of vision, and usually the only way to know about it is to see somebody.
Yeah, go and see a specialist. And if you do get those diagnoses, to not be fearful about what the next steps are going to be. And of course, all the help in the world will be available to you, as much as they can do, with Vision Bermuda as well. Thank you, Dr. Jake Smith, for coming by today. It's been a pleasure to see you again.
Thank you very much. It's great to be back.
Good stuff. Thanks, folks, for listening. Can't say you didn't know. And we invite you, this program will be repeated on our sister station, Power 95, tomorrow evening. So if you have someone who you think needs to hear it, make sure they check it out. Thanks so much for joining us. You're tuned to Ocean 89.